Good day, everyone, and welcome to the world of the International Fab Talks. International Fab Talks is all about creating awareness and connecting with the right kind of people across the globe. Today, we are privileged to have the presence of a wonderful guest, a doctor who is going to talk about blood donation, of how we could understand the importance of donating blood and saving lives. That's really a beautiful thing in this world when you can save another person's life. Don't you want to be a part of this beautiful journey? Yes, but it is important to know who should donate blood, how much blood can be donated, when to donate, and all the information we are going to take out now from our celebrity and guest. He's here on a mission to create awareness about blood donation. Join us, friends, to welcome our celebrity and guest. He is none other than Dr. Anil Kumar, joining us all the way from Hubli, a lovely small city in Karnataka, India. Hello, sir, and welcome to the session. Thank you so much for being here with us.
Hello, madam. Hello, everyone.
Thank you, sir. Thank you very much for being a part of our journey. Thank you for agreeing to share your knowledge with regard to blood donation. Thank you very much. I just share your profile in a minute and then we begin the session.
Sure.
Thank you, sir. So, dear friends, as I earlier mentioned, we have Dr. Anil Kumar P.S. He is going to really share with us the right message with regard to blood donation. He is actually the blood center officer in KIMS, that is Karnataka Institute of Medical Sciences, which is located in Hubli, Karnataka, India. He's one of the best doctors and he has been inspiring several youngsters and the right kind of people to be a part of this blood donation organization camp, blood donation to be very precise, to put that very right. So I'm really happy and excited to get to know who can donate blood and why one should donate blood and also what are the dangers and the risks involved. All of that we will get to know today on this session with regard to blood donation and with Dr. Anil Kumar. So thank you so much for being here with us, sir. It's really a honor to have you here, share that and create awareness. You could really save lives in the right way. Now, doctor, you have been associated in this field since how many years with regard to blood donation and as being a doctor and all of that in the medical stream?
For the past 19 to 20 years, I am in the blood center officer in KIMS. Right now, when I started my journey, initially there was a lot of hiccup to give the blood donation because of lots of misconception in public about the blood donation. If you give the blood, we are going to lose the potency. The male I am telling. That's what all some nonsense concepts were there. So it was very difficult to motivate public to donate the blood, create awareness. This is a small procedure. Nothing is going to happen. You are going to save public life. That is what we wanted to bring change in the society. Somehow, for the past, initially we were very difficult to mobilize, but as the journey progresses for the past 20 years, the things have become a little bit easier for us. City-wise, okay. Public, they are quite aware of this public donation, blood donation, all those things. They're doing it. When it comes to rural background, it is still harder. So little percentage of people still they are reluctant. When they come to blood bank, they say, sir, I will pay money. I don't want to donate the blood. This is how the conception is. But still we try to ask them to donate, see that their dear and near one gets survived in some critical situation.
Yes, that's really nice. Thank you so much. And you've also mentioned about the rural background where people hesitate, to come forward for blood donation. And thanks to the people who are in the city who understand the importance of blood donation. I'm really happy to know that the people in the city and towns agree to blood donation on many occasions. Now, sir, the major questions for most of the people who haven't yet donated their blood to save a life. Could you just share with us who are the people who could come forward and donate blood?
See, blood donation is a very simple procedure. We have certain criteria to donate the blood. Those who works in the blood bank, we will not take them right now. The thing is, we have some criteria. First is age criteria. From 18 years to 65 years, anyone can donate the blood. But provided we have some clauses, because 18 years, the developmental activities of the body, brain, everything will take place. We try to avoid. After 65 years, the patient will, when donors will have some health issues. So we try to avoid. So 18 to 65 years who are healthy, and we do some parameters. That is, we check the weight. Minimum of 45 kg should be there. Then we do their hemoglobin. That is a blood concentrate. How much blood content is there in the body? That we call it as hemoglobin. it should be more than 12.5%. That much, these are the two criteria we take. Some people, they ask, sir, I am diabetic, can I donate the blood? Yes, sure. It is not contraindicated. Only thing is, we check their latest blood sugar and they should not be on insulin, only oral anti-diabetic drugs. If they are taking, if the sugar is under control, yes, definitely they can donate the blood. Second thing is, we come across about hypertensive patients, BP patients. They say, sir, I am having BP. Can I donate the blood? Yes, you can also donate, provided BP is under control and we take some relevant history for these BP patients, sugar patients, then we ask them to donate the blood. So these are the minimum, what we call it as minimum criteria. So to donate the blood.
Yes. Thank you, sir, for sharing that. Now, sir, how long does it take for a person to donate a bottle of blood, or like the minimum amount of blood that is withdrawn from an individual for donation?
Minimum amount what we draw is 350 ml. 350 ml of blood we draw. It takes around 3 to 5 minutes. Simple procedure. It takes around 3 to 5 minutes. Then once they donate the blood, it will be resynthesized. Means it will be manufactured within the body. Why? Within 3 weeks. 3 weeks, person will be able to resynthesize the blood what he has given to other person. Then, so what we do is, we ask the person every 3 months, healthy individuals, male, they can donate every 3 months. For female, little bit because of health issues, menstruation, all those things, we keep a gap of 4 months. So healthy individual or male can donate every 3 months. Females every 4 months. Without any problem, they can donate. This is how we tell to the donors.
Yes, that's really nice. Thank you for sharing about the donation of blood that, you mentioned about the male and the females when they could again donate their blood. Once they donated, again, 3 to 4 months gap with regard to their gender. That's really nice. Thank you for sharing that. Now, sir, how many kinds of blood groups are there and which is the most sought after blood group in India?
Actually, blood group means routinely, what we say, general public, what they know is A, B, AB, and O. In that, along with that, we have RH. RH positive, RH negative. This is the main blood group. What we are, public is aware, public are aware, and we are also doing those things. Along with that, we have so many subgroups. As the advances in blood grouping system has developed in the past 20-25 years, we have so many other blood groups like what we call M, N, P, F, Kelly, Duffy. So many blood groups are there. So, but for our transfusion purpose, we consider only ABO system, RH are important. So what we do, routinely when the patient comes, we check for ABO, RH compatibility, then we issue the blood. Because all these things, other blood groups, this for academic purpose and very difficult to do all those things. And cost-wise, patient cannot afford. And it is not needed also. With this ABO system, patients are happy, donors are happy, everyone is happy. So we are proceeding with this ABO system group only.
Yes, sir. Thank you, sir. Thank you for sharing that. Now, doctor, there are several people who have already donated their blood and many of them would be ready to donate their blood. But the question here arises now, if they face an emergency in their family or friends circle and they would like to, get some help with regard to blood donation or the blood group doesn't match. So because they have donated blood at one point of time, could they get help, immediate help or something like that for their near ones and dear ones?
Yeah, definitely. See, the thing is, once they donated the blood 3 months, they can't donate one more time. That is one issue. They can't get one more unit of blood. Doesn't matter. If they really emergency, definitely we are there to help. We'll give 1 unit of blood. Doesn't matter. If whenever they feel like comfortable, whenever their relatives, when they have friends, they can bring in 1 unit of replacement. Otherwise, we'll issue maximum voluntary donation. We collect from the camps, then we'll issue like that only without any asking any donation from the relative, because we know some emergency, because this is a blood donation is an requirement. Sometimes it will be an emergency procedure. So we take care. Patient should not suffer. That is our motto. So definitely we'll donate. We'll give 1 unit of blood. It's not that only those who are donated for them only will be given. It's not like. So in our hospital, so many people they are coming daily. Will be issuing around 80 to 100 units of blood. In that, hardly 10 to 20 they will be replacing. Rest of the thing we'll be collecting from blood donation voluntary camps, then only we'll be issuing to them. So it is not a problem. we have sufficient stock, sufficient volunteer people they are donating, so we are able to manage the situation.
Yes, sir. Now, sir, compared to other foreign countries and our country, India, how far have we been able to save lives with regard to blood donation? Like how many, if we compare the statistics and see, has India come up to that level where they have been able to save lives with regard to blood donation?
Actually, statistics definitely in foreign countries they have very good setups. They have links. I mean, all those things they have. All, in our country, it's very difficult to maintain such thing. But still, compared to previously, for the past, I'm telling you, for the past 10, 15 years, not tremendous improvement has been done in our country. Definitely, that's when the death rate because non-availability of blood it has come down very much, very negligible. But compared to developed countries, definitely we are a little bit lacking, but we are able to achieve nearing to that level. Not that level means at least nearing to that. We are able to match to developing countries level.
Yes, sir. That's really good news, sir. Now, sir, we've also heard that certain blood transfusions are quite fatal. And in certain cases, certain patients have contracted HIV/AIDS. Now, how far is this true? We've been reading it in different, articles like online and offline. How far is it true? Is it really true?
Regarding the fatal reactions, it is true because the thing is, in spite of what I previously I told you, so many blood groups are there. Because of that, up to 99% of matching can be done with all this procedure. Less than 1%, there is chances of transfusion, what we call it as transfusion associated reaction. But only thing is, the person who transfuses, the doctor who transfuses the blood, you should be aware of this. And while transfusing, you should be cautious. Something goes wrong, you should stop the transfusion. See that preventive mechanism. When you should transfuse, the other preventive measures will be there. How to prevent this reaction? He has to take all those things so that there is death rate will be minimized. Nowadays, we are not hearing the transfusion associated death rate. Very rarely, once in a million or something like that. Very rare. In cities, it is very rare. Some rural background because of unawareness, all those things, it may happen. Really, I don't know. And in our setup, till now, we have not come across of any death of the patient because of blood transfusion reaction due to death transfusion. And regarding this transfusion of what you asked me about infection, HIV, and all those things, we have stringent regulation. Once the blood we received from the donor, we do all the tests. 5 tests basically it has been prescribed to blood bank. So we are supposed to do all the things like HIV, hepatitis B, that is jaundice B, hepatitis C, and VDRL, that is we call it as syphilis. One disease is syphilis, then malaria. These are the 5 tests, mandatory tests. This being prescribed by the drug controller who is regulating this blood bank. They'll ask everyone to perform this test. Only negative samples which are negative for these diseases will be given to the patient. We want the safe blood to be transfused to the patient. We should not suffer from some more disease because he has come to us with some disease. We should cure it. We should not create some trouble. So that is the motto. So we will see that everything will be negative for these diseases. Then only we will issue the blood. That mandated rule we are following strictly. So that no one will suffer from this. All this what you asked, the HIV and all those things.
Yes, I get that. I understand that. Now, sir, once we donate blood, then what is the immediate feeling of that person who donates blood? Some of them have complained of dizziness, fatigue, etc. So you being here in this field for more than 20 years, what have you seen around you in the blood donation camps, etc.? How do people react after donating blood, and what is their physical condition?
Yeah, the thing is, first-time donors, especially first-time donors, youngsters, they'll be a little bit apprehensive. Especially we see in the camps, they'll be a little bit apprehensive. They come with us, or whether can we give? So hesitation, apprehension, all those things will be. So we try to convince them. We'll not force anyone to donate the blood. So that's one thing. Second thing, what happens because of apprehension, their activity will be increased, and once after donating blood, they feel that something has happened to me. So they will feel giddiness, all those things, some sort of psychological problem. everything will settle down because we know it will happen. So we'll not ask them to donate the blood. See, we'll convince them, make them cool, then only you donate the blood. Because hardly 350 ml of blood you'll be taking. So we'll ask them to drink plenty of water. One thing. Second thing is food. We'll ask them to have something to eat and come. Otherwise, because of sudden loss of blood, sometimes because of food defect, they have not taken 2 hours prior, then they'll have this. All these precautions we'll take so that they'll not suffer from giddiness. Still, some people, because of so many unknown factors, they suffer from giddiness. Sometimes we'll ask them to lie down. Extreme condition, we transfuse 1 unit of fluids, glucose. They'll be all right. So that percentage will be very less, but still certain people you have transfused, they'll be all right. Sometimes they'll be all right after transfusing glucose bottle.
Yes, thank you, sir, for sharing that. Now, sir, there are certain people, the youngsters especially, they have tattoos on their body. Now, people who have tattoos, are they also eligible to donate blood?
Yeah, tattoos, because tattoo, how they have taken the tattoos, we don't know. Because that is prone for what we call hepatitis B. Prone, because they use the sharing needle. We don't know how they'll do the tattoo. So we try to avoid for 6 to 8 months. Those who have been recently tattooed will not take their blood. 6 to 8 months, we'll ask them to wait. Then they can donate to blood. They are also eligible to donate. Other criteria are fulfilled, we'll take the blood.
Yes, doctor. Thank you for verifying that. Thank you so much. Now, doctor, is blood donation confidential, or like, how would you answer this question? Like, there's a question, is blood donation confidential, or you come to know that so-and-so person has donated blood, especially with near and dear ones, or you'll keep it confidential?
Sorry, I didn't got the point. Confidential means what in what?
I mean, like, see, we don't know who. Now, suppose now I am of a certain religion. You are of a certain religion. You are donating blood to me to save my life. Yes. And then,
Okay.
And there's nobody else to donate the blood, and your blood and my blood matches. And then we belonging to a certain community will not agree with the person who has donated blood from another community. So is there and the person's life is in risk. So at that time, will there be some confidentiality that will be maintained just to save the life of that particular patient?
Definitely, because see, no one will come and ask because of this religion I want this blood. No one will come because what they want is this blood group. That's all. Human being, here comes the human being. No religion, all those things will not come. So it is not necessary that some religion people give to that religion. It is not like that. In our profession, will not think of those things.
Excellent. I really like that. That's really nice. So, friends, irrespective of whichever community or religion you belong to, you should come forward and donate blood and save lives. We belong to one great race that is called as the human race. Now, sir, there are certain people who have even asked us this question: if I am on medication, am I eligible to donate blood?
Medication means that's what I told you. Suppose the patient is on any anti-epileptic drug, the FITS drug. So patient here is not eligible to give the blood. And patient is on any thyroid disorders. Endocrine, we call it as endocrine disorders, thyroid disorders. They are not eligible to give the blood. Some kidney problems. So long-term complications. Patients who are on HIV therapy. HIV patients, definitely they can't give. So patients on treatment hepatitis B, jaundice. So certain criteria. We don't ask them to donate the blood. Hormones, they taking some hormones. All those people, they are not eligible to give the blood.
Yes. Now, sir, what about pregnant women or breastfeeding mothers? Are they eligible to donate blood? Because certain times we see their very own kith and kin need blood, and their blood group may be matching, and they may come forward to donate blood. So are there...
No. Pregnant woman, lactating mother, because they are in need of blood. First of all, they are in need of blood. So you can't expect them to donate the blood. The donor means they should have sufficient quantity in their body. So they usually in our setup, pregnant woman and lactating mother, they are deficient of blood. So they are not eligible to donate the blood.
Yes, sir. That's really nice. Thank you for sharing and creating awareness, sir, with regard to that question. Now, there are people who suffer from low BP and high BP as well, but they would love to save a family member. They would love to save a friend. Now, are they eligible or suitable to donate blood to save their loved ones?
Already I have told you, Low BP as a you don't have as a concept. Low BP don't have as such, because low BP means I call it as hypotension. Patient BP is already low, they can't donate the blood. That's one thing. High BP, provided they have it is under control, and we will examine the donors. That's what I told you previously. Diabetic and hypertensive patient, we examine them thoroughly, ask them questions, what are the tablets they are taking, what is the BP. So we try to evaluate. Then only, if it is everything is under control only, then we will take the blood. Otherwise, we will not take the blood.
Yes. So another question like which we've always received from our audience and viewers is like they have traveled to different countries or they are coming from some other country and specifically to see their loved ones who are ill, and then at that time they would want to donate their blood. So the people who have just come from other countries, are their blood, I mean, is their blood okay to be donated?
Yeah, definitely. Other country doesn't matter. See, I told you the human race. Whether other country, other part of the things doesn't matter. If they want to donate, let them. It's a good thing. They are doing a good service to humanity. Definitely, we'll take. It's not a contradiction.
So now there are people who are substance abusers. I mean, they might use various kinds of substance abuse, like maybe alcohol, drugs, etc. And are they eligible to donate blood, sir?
No, alcohol, only alcohol, that too, with limited this thing we'll observe. Drugs, we are not going to take them because they'll be injecting so many things. They are prone for hepatitis B, HIV, all those things. So drug prone, taking people, we will not take the blood from them.
Now, sir, earlier there were certain patients who suffered from anemia, but now their hemoglobin count is high. Are they eligible?
No, because anemia means already they are in low. High means it will be, I think it will be a normal blood. If
so
we
maybe
see
initially 2-3 years they had suffered from anemia, but now their health is very good. Are they eligible to donate blood?
If it is what we do, hemoglobin, already I told you, hemoglobin should is more than 12.5 grams. Definitely we'll take. It's not that some 2-3 years back they suffered from anemia. It's nothing like that. If now right now the conditions is favorable, definitely we'll take.
Yes, sir. Now, sir, people suffering from epilepsy, multiple sclerosis, and neurological disorders, and they would love to save their loved ones, are they also eligible to donate blood?
No, epilepsy, multiple sclerosis, all those things, neurological disorders, because already they are suffering from disease, so they are not eligible to give the blood.
Yes, sir. That's really nice. Thank you so much, sir, for sharing all of this. One last request is, what is the message you'd love to share today to create awareness with regard to blood donation?
Blood donation is a noble cause. So whenever we go to the donor camp, we say every 3 months you donate 1 unit of blood. In that 1 unit, we split into 3 components like total packed cells, plasma, that is fluid component, platelets. So packed cells will be given to patients who are anemic. Plasma to the liver patients, liver failure patients, then burns patient, all those patients. Then platelets, as you are quite aware, now dengue is quite common. Platelets will be given to dengue patients. So if you donate 1 unit of blood, you will be saving 3 lives. So that once in 3 months, you imagine, so that you are donating 1 unit of blood, but today, after 3 months, 1 more unit. So three patients. So every year, you'll be saving 12 units of 12 lives. So that is the thing, you should be proud of it. So that you are contributing so much up to the society. So donate more, take your friends, bring them, ask them to donate, so that your contribution to the society is very much appreciated. Then you will feel that, yes, I have done something good. This is one point. Second thing is, those who are donating, you give them card, voluntary donors card, so that whenever their friends or kith and kin, they have any problem, they can bring that card, take 1 unit of blood, just like depositing in the bank money, taking their money back. That's one thing. Second thing, it has been proved the person who donates regularly, the cholesterol content in the blood, it will go outside, then pure blood will be synthesized in the body, then the incidence of heart attack will be 0. So those who donates regularly, they will not suffer from heart attack. These are the 2 things we try to tell to the donors, so that they will get motivated to donate and bring their colleagues or friends to the donation side.
That's really great news. That's really very nice. You've shared the end part very well, that you encouraging everyone to come forward and save lives. One person can save 3 lives, you said, right?
Yes.
That's really nice. And you also mentioned that, you know, blood donation, you know, you are doing a service to the society. You're giving back something very positively. And also you mentioned that it reduces the risk of heart attack.
Yes, yes.
Cholesterol level will be reduced, etc. That's really great information. So I didn't know that, and many of our friends didn't know that, our team. So that's really nice. Thank you so much, sir, for taking out the time and being here with us. We look forward to many more interactions with you, and we'd love people who view this video to become, you know, great contributors to the society. If you could, in your own way, be a great donator of, you know, just anything. It could be your blood as well, to save somebody's life. That would be really nice. Donate your time, donate your blood, or donate anything that you can from your side to save the world in the right way. If you do good, good karma comes back to you. Sir, thank you very much, sir. Tumba
Thank
thanks.
you, madam. Thank you. Thank you.
Thank you, sir. Thank you. My dear friends, with this, we come to an end to the International Fab Talks for today. I'm sure this was an educative session, an awareness session where you come to understand the importance of blood donation. We are very happy and thankful to have our celebrities sharing the time here today. He is Dr. Anil Kumar. After a busy schedule, you know, after a busy day today, he has taken out some time, especially for you and for me, to share about blood donation and create awareness. Do share this video with the right kind of people and spread awareness and save lives. You never know when you may need it for your loved ones or for yourself as well. And if you like what the International Fab Talk team is doing, connecting with the right kind of people and creating the right kind of awareness, stay connected with us. Like, comment, subscribe, and share to the International Fab Talks. And above all, love yourself, respect your family, and protect the universe. Stay safe. Thank you, sir.
Thank you, madam. Thank you.
Thank you, sir.